Okay, so you've been scheduled for a facet joint steroid injection. And the question is, what is a facet joint steroid injection? A facet joint are the tiny joints in your spine from the top of your neck all the way down to the sacrum, where movement occurs in the spine. There are two joints at each level, from the top of the cervical spine down to L5-S1. And those joints move into flexion and extension and even a little rotation. If we look at the spine model of the lumbar spine here, the facet joints are these tiny little joints on each side. And if you look closely, the facet joint that we're talking about is this little joint right here. I'm going to kind of open it up by twisting, and you can see how the joint opens. So it allows us to flex, it allows us to extend, and to rotate. But the problem is, over time, because of wear and tear and things that we do with our life and the fact that we stand upright as we walk, those joints get arthritic and they get inflamed and they cause pain. And so one of the ways that we treat those joints is to do an injection of steroid medicine and numbing medicine into those joints. So when you come to my office and we see you and we decide that you have pain that's coming from a facet joint, oftentimes we'll do an x-ray or an MRI or a CAT scan, and we'll see the arthritic changes on those films. And that way we can pinpoint the joints that need to be injected. When we do a facet joint injection, we bring you into the office and we start an IV, because we're going to give you a little IV sedation so that you're comfortable. It's not a painful procedure and you're not moving when we do it. We take you back to our procedure room, we give you a little IV medicine, and I use a live x-ray machine called a fluoroscope, where I can look and pinpoint the facet joint. Once I pinpoint the facet joint that I want to treat, I use what's called a spinal needle, which is a 3.5-inch needle. And as we look at the anatomy of the spine, I use this needle to guide down and guide directly into the facet joint. And once I'm in the facet joint, and I can see that on the x-ray machine, and I can even put a little contrast in and see it in the joint. Once I'm where I want to be, I inject steroid medicine and pain medicine into the facet joint. And when we do that, the hope is that we're going to reduce inflammation and pain from that facet joint. So oftentimes we'll do multiple facet joints if there's arthritis at multiple joints, but we try to pinpoint the joint where the pain is coming from. And that all depends on your symptoms. Once we do the injection, we pull the needle out, we put Band-Aids on. We'll usually keep you for 15 minutes or so to make sure you're recovering well, and then we send you on your way for that day. We usually follow you up about 2 weeks later to see how the injection has done and to start you on a rehabilitation program. So the purpose of the injection is to reduce pain and inflammation at arthritic joints in the spine. We may do them in the neck, we may do them in the mid-back, we may do them in the low back, all depending on where your pain is and where the arthritis is. So that's what a facet joint is. That's what a facet joint steroid injection is, and that's how we do it. So any questions that you have, feel free to email me at our email. Feel free to email me at moeoeverywherewego@gmail.com with questions. And I'll see you the day of the procedure. Make the most of every opportunity.